That's the other email question. And we're doing that. What about the anesthesia?
An hour of general, and it's long as the
I have no question coming up. Okay. There is do have open life and mental question.
The manufacturers are up to they're for they're not a lifetime. You have long, but it's here until a rub.
That was so. If it has a T in 10 years, if there's
nothing wrong with the friend to read to take it, that'll one for about nothing wrong. I say leave it.
All right, and Tom's on the line. Hi, Tom.
Yeah.
You go ahead with your question.
Yes, I did about the fact that this influence the MRI. It's possible that MRI, kidney cancer, after she had grown in breast, her breast had a implant, and the doc would look at these scans, and all he would see would be a big white circle. He says, "Don't worry, you're okay." And behind it was where the tumors were growing behind it, and then they metastasized to her kidney, and she died very quickly after that.
Sure. Well, it depends on when it was, but imaging today is much more advanced than it used to be. In addition, it sounds like that implant was placed above the muscle, which is why majority of times I place it below the muscle, so that your breast tissue is not being hidden, or it's not being distorted by the implant. And so it's certainly, imaging is much better than it used to be. It's hard to say, obviously, in her situation, but it's really, we have really good techniques to determine breast cancer.
And thank you for your call, Tom. And if you'd like to call us, 361-4675. That's 361-4675 with your questions about breast augmentation. Actually, that does bring up an interesting point, because since you choose to put it underneath the muscle, the breast tissue's on top, you get a much better visibility of any changes that might occur in there.
Absolutely.
Now, if somebody comes in, you said that you give them a full screening to rule out, obviously, in case they had anything going on there.
Sure. You need a full exam. We're doctors. We still do a full exam to make sure they don't feel any masses. And if there's a family history of breast cancer, or if you're due for your mammogram, I won't proceed with surgery unless I see a documented mammogram in the last year. If you're 40 years or older, or even 35 with a family history of breast cancer, I'll make sure I see that mammogram to have a baseline, and go from there. Absolutely.
All right, when we come back from our break, Dr. Engel will be here to answer more of your questions about breast augmentation surgery. It's a great time to write the number down, 361-4675, or go ahead and call us, and we'll take those questions when we come back. Stay with us. Welcome back to Local Doctors on Call. I'm Alex Redman, and today we are talking about breast augmentation. So please be advised that this show may contain sensitive material, because we're showing before and after pictures about breast augmentation. All right, doctor, there's a lot of things that we hear, discounts on breast augmentation surgery, and we hear about a lot of people performing these surgeries, but how do you know who to go to? I mean, if you're having a breast augmentation, and someone is a general surgeon, but they're performing plastic surgery, is that the person you should go to, or are there any special credentials?
Sure. It's very important that you know about the background and the training of your surgeon. I'm board certified by the American Board of Plastic Surgery, and I'm a member of the American Society of Plastic Surgeons. My partners, Dr. Braun Graham, Dr. James Schmidt, and Dr. David Mobley, are all members of the American Society of Plastic Surgeons and board certified.
And I think you have a symbol that you want to show.
You need to see this symbol. This symbol here shows that we are members of the American Society of Plastic Surgeons, and we're board certified in plastic surgery. There's a lot. Doctors can perform in their own offices any kind of surgery they want, office-based surgery. They're not mandated. Now, at Sarasota Plastic Surgery, we have a licensed ambulatory surgery center, and we have the highest credentials as far as training for performing these procedures. You need to make sure that your doctor is a board certified plastic surgeon. And that symbol is the best way to find that out. Unfortunately, there are people who are not adequately trained and want to do elective cosmetic surgery for the financial gains. And by making sure and seeing that symbol, you know that your doctor is going to follow the ethical principles of our society, and has been trained appropriately.
All right, we have Lynn on the line. Hi, Lynn. Thank you for calling the show. What would you like to ask Dr. Scott Engel?
Okay, I'm 73. I've lost a lot of weight. I exercise. I've been exercising in the gym for 3 years. I got muscles all over my body. I'm really strong lady. And if they last for 10 years, I'm all set. I was a C cup, and I like them perky.
Sure, absolutely. I think one of the things that you have to understand is that many times, and especially as we get older, our skin is not as tight as it used to be. And so putting in an implant sometimes is not your only answer. You can't just lift the breast with a large implant, otherwise you'll just have large, droopy breasts. And so one of the things there is actually doing incisions that actually lift the breast up. So one of the ways you can figure that is if you lift your breast up and you like that size, then you just need a breast lift or something called the mastopexy. However, if you lift it up and you want to still be a little bit larger, then you do a combined procedure where you're going to augment the breast and you'll also lift it at the same time, called the mastopexy augmentation. So that's kind of how you can get a gauge of really what you need. Do you need just an augmentation, just a lift, or a lift and an augmentation?
Thanks for your call. So what's the next step if someone decides they want it done?
Sure. Well, again, making sure you're going to know the education and the training of your surgeon. And I'd be happy to see patients in our office at Sarasota Plastic Surgery. And we have our information here for you to see.
You can give out that phone number.
It's 941-366-8897. And sitting down with a board-certified plastic surgeon to really know your options and just get the information and be educated. And that's our biggest thing, making sure patients are educated about what they're going through.
So the best thing to do for anyone is to come in for a consultation and see if the fit's right.
Absolutely.
All right, and also if you'd like to reach out to Dr. Scott Engel, you can reach him at the phone number, which again is 366-8897. That's 366-8897. Also at sarasotaplasticsurgery.com. We'd like to thank you for being on the show, Dr. Engel, and we'd like to thank you for taking time out of your very busy day to spend it with us on Local Doctors on Call. We'll see you next time, and remember, it's your health.